I focus on medical ethics and ethical theory. My background is in philosophy. That's what my PhD is in. But since I've graduated, I've focused heavily on issues in medical ethics, including ethical issues in advanced directives, surrogate decision-making, and the nature of decision-making capacity, in addition to some other issues involving ethical theory. I've written a bit on some arguments regarding the morality of abortion, and a few other issues as well. Frankly, there's better and worse ethical training, if you will, in medical schools and in nursing schools, and we have a long way to go. I've taught medical students in the past. Some of them are open to these types of issues and very interested in them. Some view the medical ethics course as a hoop to jump through, right? And when you're in a culture, a professional culture, what is done becomes what is right to do. So it's hard to push back against that. The tide is against you because there's vested interests that cut against what a lot of people think is the right thing to do in clinical contexts. So, whether we have, I have no doubt that we have some effect on students and on practice and on the professions, and medical ethics as a field has had a profound impact overall on the practice of medicine over the last 30, 40, 50 years, as medicine has turned away from a paternalistic attitude towards patients and values the value of patient autonomy has really taken precedence over the physician's authority. So that's obviously one major issue. Now, when it comes down to the more nuanced issues that are facing us today, that's something that we're hopefully going to start to address in medical education and ethics education in medicine and nursing. But I don't know how much of an impact we've had up to this point. I think there's some empirical research to be done on that. One important issue is to make sure that surrogate decision makers, those people who will be making the decisions for their loved ones at end of life, are comfortable doing so. And I've done a little bit of work on advanced directives, and there's some controversy about the usefulness of advanced directives in terms of how they represent accurately the patient's wishes. But one thing that has been shown is that advanced directives at least make it more comfortable for surrogates to make decisions, even if they don't actually accurately reflect what the patient would want in a very strong way. They do have a very beneficial effect on how comfortable the loved ones are, how comfortable the family is after the fact, after they've made the decision. They can rely on that directive and know that they at least attempted to do what their loved one would want. It's definitely on my radar. I'm actually working on a paper right now addressing the ethics of nurse participation in assisted suicide and whether there are any special ethical issues regarding nursing and assisted suicide. In the United States, assisted suicide is legal in 5 states. California just legalized it last year and it came into effect this year. And there's no reason to think that this trend will abate in coming years. So assisted suicide is going to become more and more prevalent in the U.S. Currently in the U.S. it's limited to terminal illness, and just having, say, severe chronic depression would not qualify you for assisted suicide. But there's a debate about this because people with treatment-resistant depression, their mental pain, if you will, is just as real as the pain of a cancer survivor. It's just a different type. And a lot of people argue that terminal illness shouldn't be a requirement of assisted suicide. Obviously, that's very controversial. But people argue that, well, look, if your suffering has no end point, then you're in a worse position than someone with a terminal illness who at least has, you know, the end in sight, if you will. So yeah, I mean, these are controversial issues, and you know, the United States has taken kind of a moderate step forward in this area compared to Europe, or at least certain European countries like the Netherlands, Belgium, and Luxembourg, which have legalized euthanasia, which is kind of the next step beyond assisted suicide.